Hello, everyone. Thank you for joining us for the breakout session. I'm Dr. Jamie Reedy, Chief of Population Health at Summit Health, formerly Summit Medical Group and CityMD. I should note that we unveiled our new brand identity as Summit Health just a few days ago, and we look forward to continuing the tradition of patient-centered care. Driving that commitment and joining us here today is Summit Health's Chief Executive Officer, Dr. Jeffrey LeBenger. Dr. LeBenger is a visionary and thought leader in physician group practice management, value-based care, population health management, and other timely issues that impact the quality and accessibility of healthcare. Also, I'm very pleased to introduce Dr. Jack Capitelli, Chief Medical Officer of the New Jersey region at Summit Health. Dr. Capitelli is board certified in internal medicine and a proven clinical leader who's overseeing our medical care model for our multi-specialty and urgent care practices in New Jersey. Thank you both for joining me in this important conversation today.
Happy to be here, Jamie. Thank you.
Let's start off with the big picture, including how Summit Health is helping our Medicare eligible patients reduce healthcare costs. Summit has long embraced the coordinated care model as the best way to deliver quality care and improve patient satisfaction. Our emphasis on preventive care and collaboration with partners in accountable care organizations, or ACOs, is aimed at improving our patient experience and enhancing the healthcare delivery system. Patient benefits from ACOs include improved care, lowered costs, increased opportunities for patient engagement, better care coordination, lower readmission rates, and better management of chronic conditions that can impact our patients' quality of life. Dr. LeBenger, can you elaborate on Summit's involvement in our Medicare ACO and our overall clinical partnerships with our Medicare Advantage health plans?
Thank you, Jamie. So we have been involved for years with Medicare ACO, the Next Gen ACO, and we've also had clinical partnerships with MA health plans within our region. We want to ensure that we cover all services that we provide, and we have adequacy for all specialties, all ancillaries within our integrated healthcare model. And we provide home-based healthcare, visits, meal support, transportation, whatever is necessary to have that complete package for care for our patients at Summit Health. We are committed, absolutely committed, to lowering healthcare costs for the Medicare Trust Fund, avoiding unnecessary and unwanted care, improving efficiency of care, as we call transition of care and gaps of care, and improving preventive medicine approaches for the patient. We want to be transparent with the healthcare for New Jersey residents to be able to provide the best care through our entire integrated health organization, to have all specialties, to have all ancillaries, to provide socioeconomic as well as psychosocial care for all our patients within our ACOs, as well as our MA plans that we partner with health plans.
Thank you, Dr. LeBenger. We've all learned across the last couple of years of partnering with both Medicare and our Medicare Advantage plans that providing great care is a team sport. And we have developed a team of care providers at Summit to take care of our Medicare patients, regardless of where they go, and to coordinate their services, as Dr. LeBenger has talked about. Next, let's discuss the different healthcare insurance options that are available to our seniors and what's important for both Medicare eligible patients and their caregivers and loved ones to understand about Medicare, because we know Medicare benefits is a very complex situation. In particular, the differences between traditional Medicare and Medicare Advantage confuses a lot of our patients. Dr. Capitelli, how do you typically explain the difference to your patients and talk with them about their options?
Thanks, Jamie. It's a very common question. It can be very confusing. Most of my patients ask me this as they approach 65. And I think the way to look at it is just think about it slowly. Traditional or the original Medicare encompasses two types, Plan A and Plan B. Plan A covers hospitalization. Plan B covers other medical expenses. And so that leaves a lot to be covered besides hospital and just other medical expenses, such as prescription plans. So Plan D is prescription plan. A covers hospital, B covers traditional medical services, and D covers prescriptions, but D is a supplemental plan. Now, having said that, there's a lot of gaps in that care that are uncovered, things like dental or vision or actually other prescription costs, out-of-pocket costs. So there's something called Medicare Advantage, which you considered Plan C. And Medicare Advantage is similar to Medicare. You're part of Medicare, and all the traditional services of Medicare are offered. But at a lower cost and almost a zero premium, other options and types of services are offered, including vision, dental, prescription costs. It almost acts as a wraparound for all the other costs that the traditional plans A and B do not cover. There's another option called Medigap as well. Medigap is a little different in that Medigap is a private insurance plan that covers these wraparound services, but usually at a higher premium cost. So again, to reiterate, Plan C is considered Medicare Advantage. Medicare Advantage can be less expensive, less out-of-pocket expense, in some cases almost a zero premium, and acts as almost a wraparound for those for those other services that may be required.
Thank you, Dr. Capitelli, for breaking down the differences there. Want to stress to our viewers as well that Medicare permits health plans who offer Medicare Advantage options to also offer programs that are unique, such as exercise programs to help our patients remain active, or even meal support for patients who may qualify or need nutritional support for their chronic illnesses. So as our patients analyze these differences, they want to take those considerations into mind. So you did mention, Dr. Capitelli, the supplemental Medigap plan. Can you help our patients understand a bit more about how Medigap works compared to Medicare Advantage?
Sure. So Medigap is a little different than Medicare Advantage. There's basically a set premium paid by the patient to cover all those wraparound services. And essentially, you're paying almost a lump sum for all those covered services, when in fact, some patients may not require such a lump sum or such a high payment. So it's a private insurance wraparound plan that you can purchase. And it basically covers all those other expenses, but some of the Medigap plans do not cover prescription costs. So you have to be very careful when you're looking at these plans. The Medicare Advantage plans in general have similar coverage at a lower cost, lower out-of-pocket expense. So it's important that when you look at your total care, how many times you're going to the doctor, total prescription plan costs, and all the medical services that you use, that you sort of analyze these very carefully before making this decision.
That's right. Thanks, Dr. Capitelli. I do want to stress to our viewers again, this complexity can be very confusing. And we at Summit Health have partnered with the sponsor from today, Advise Insurance, and we strongly recommend that our patients and their caregivers seek consultation, a complimentary consultation with Advise to review all of the Medicare benefits that are available to you in the county where you live. Another important element of our patients' healthcare is continuity of care. And we know that staying with a doctor whom you trust is very important to successful healthcare outcomes. Additionally, it's important to engage seniors in key healthcare activities such as annual wellness visits, health risk assessments, and other health screenings to help close quality gaps and engage seniors in their care year-round. So a two-part question for our panel. Dr. LeBenger, how can patients stay with their doctor, particularly as they make choices about Medicare benefits and coverage? And Dr. Capitelli, what should our viewers know about annual wellness visits and other preventive health measures? Dr. LeBenger, would you start us off?
Sure. We are very proud of our long-term relationships that we've built over the years with our patients. I am still a practicing physician, and it's always about the provider-patient relationship, and that is dear to us at Summit Health. We are participating with all our MA plans, and we have strong relationships with the health plan that help us maintain this continuity of care with our patients. Bottom line, you want to see the doctor you want to see, you will see the doctor you want to see. We have adequacy within our organization, that we have every specialty within it. You can see that patient. We can also call a Medicare expert like Advise Insurance, who can provide a side-by-side comparison of who is available and who is in that plan. And we at Summit Health are in those plans, and they could go over that. They include the costs, the benefits, whether or not Medigap versus MA, what is best for you, that you can keep the doctor that you are already seeing.
And Jamie, I want to stress the importance of just the annual Medicare physical. That's the backbone of primary care and taking care of our senior citizens. Essentially, it's a visit that occurs once a year that's free to the patient, where they sit down with their primary care provider and go over all the current recommendations, and including vaccination rates and mammography recommendations, colonoscopy recommendations, where they review your medications, review all your disease states, and really sit down and spend time with you and map out a great care plan for you. It's a great opportunity for the patient, to ask questions, and it's a great opportunity for the doctor to build rapport with you. And it's really at no cost, and it lays out your whole plan for the entire year. And we encourage all of our patients to come in for that on a consistent basis.
Cost of care is a major consideration for patients. How can patients calculate out-of-pocket healthcare costs? Dr. Capitelli, can you help us break this down a bit more?
Sure. So this is where it's helpful to think slowly, to take your time, set some time aside to make sure that you write down all of your care. So that includes how many times you go to the doctors, what are your health conditions, what are your medications, how many medications you're taking, and to sit down and actually map out your overall plan. And you can sit with your physician while you're with them at the annual Medicare physical as well to discuss this. But sometimes it's also helpful to have a family member present, or a loved one or spouse, etc. Because what you're trying to do is to see which plan works best for you. For Medicare Advantage, it's important to consider things like, do you have dental costs? Do you think you need hearing aids? How many prescriptions are you on? Because Medicare Advantage at a lower cost can get you many of those services. You may have a tremendous amount of medical care costs where you may be willing to pay a higher premium to get the wraparound insurance, but these are very, very personal, patient-specific questions. Family members can help, and also services like Advise can really walk you through this process. And your primary care doctor can help you with it as well.
Thanks, Dr. Capitelli. Finally, it would be remiss for us not to touch on some considerations related to COVID-19, which has had a sweeping impact on healthcare. 1 year after the pandemic started, we have 3 COVID-19 vaccines authorized by the U.S. Food and Drug Administration for emergency use, and a phased rollout is underway. Many Medicare eligible patients, understandably, including access to the vaccine and coverage under Medicare. Dr. LeBenger, what are some important things for our viewers to understand?
Thank you, Jamie. First, Medicare covers the COVID-19 vaccine 100%. Now, the question is, how do you get your vaccine? States are making their own decisions who gets the vaccine first. And while older Americans are being prioritized across the nation, the exact age of eligibility varies from state to state. At Summit Health, we have a process to gradually make vaccines available to all our patients in a phased approach. And what we do is prioritize the elderly with high risks first within our organization. Now, our recommendations of how we want to proceed is being processed through the state. So what we would tell all our patients, because the access to vaccines are low, that try to make a priority to call the state to get their vaccination sites and get online and get a vaccination. We are trying to prioritize, again, we are absolutely trying to prioritize our Medicare patients to get the vaccine as soon as possible.
Before we conclude, I want to summarize some key takeaways, as I know we've presented a lot of information. We also received many questions from our listeners with a few common threads, namely questions related to COVID-19, when and how to get started with Medicare, and the differences between traditional Medicare and Medicare Advantage. First, COVID-19. We know there are many questions related to access to the vaccine and where we go from here. Much of Dr. Scott Gottlieb and Seema Verma's discussion was focused on COVID-19, and Dr. LaBenger touched on some key points that I'd like to reiterate. Medicare covers the COVID-19 vaccine at 100%, and we strongly encourage our patients to get vaccinated. The state of New Jersey continues to roll out the vaccine to eligible individuals, but allocation of COVID-19 vaccines to Summit Health has been very limited and unsteady. We have taken the approach of reaching out proactively to our highest risk patients per New Jersey Department of Health and CDC recommendations, and as our vaccine allocations and capacity allow. We recommend that you register with vaccination location options, including state and local vaccine sites and retail pharmacies listed on the New Jersey COVID-19 Information Hub. This very helpful website can be found at covid19.nj.gov. Again, that site is covid19.nj.gov. Information about vaccine availability remains fluid, so we encourage you to regularly check this website along with cdc.gov and summithealth.com for comprehensive information and COVID-19 updates. Next, many of you told us you're joining us today because you're ready to get started with a Medicare plan and wondering about the enrollment process and how to get started. I want to stress that it is never too early to educate yourself about your Medicare coverage options and begin to plan for changing coverage so that you don't have a gap in your health benefits, particularly as you retire from your job, move locations, or decide to make a change between health plans. Timelines for enrolling vary based on your individual situation. It is best to consult with a Medicare benefits specialist who understands all the available options in your county. We recommend scheduling a complimentary consultation with Advise to review your situation and develop a timeline. Medicare is complex and can be confusing. Many of the details about enrollment can be found at medicare.gov. At this website, you will find a Welcome to Medicare document that contains many important tips for helping patients enroll. In addition, you will find a very helpful Medicare 101 guide in the Summit Health resource section of this webcast, which you can download for future reference. Here are a few important facts. Some people get Medicare automatically, while some have to sign up. You may have to sign up if you're 65 or almost 65 and not getting Social Security. There are certain times of the year when you can sign up or change how you get your coverage. If you sign up for Medicare Part B when you're first eligible, you can avoid a future penalty. You can choose how you get your Medicare coverage, and you may be able to get help paying for your Medicare health and drug costs. Every situation is unique, and you may have specific questions about the best way to switch from your employer's insurance to a Medicare option, or the best coverage options if you live out of state for part of the year. We recommend you review the resources at medicare.gov and schedule a consultation with Advise to review all of the options available to you. Lastly, I want to summarize the key differences between traditional Medicare and Medicare Advantage that we discussed a bit earlier. Traditional Medicare is not going away. Patients will continue to have a choice of coverage. However, enrollment rates in Medicare Advantage across the United States have been steadily increasing for the past few years. Seniors are increasingly recognizing the benefits of enrolling in a comprehensive plan that covers Part A, B, and D costs and services, as well as supplemental benefits that can be very valuable to your health, such as dental, vision, exercise programs, or meal support. Summit Health is in network with most of the Medicare Advantage plans in New Jersey and in the process of contracting with the others. To reiterate earlier points, Original Medicare is offered through the federal government. It consists solely of Part A, your hospital care, and Part B, your medical care. If you have Original Medicare, you do need a separate Part D plan to cover the cost of your prescriptions. Medicare Advantage, also called Part C, is an alternative way to receive your Medicare benefits. These plans are offered by private insurance companies that contract with Medicare to provide your benefits. You'll still be in the Medicare program and you still have the same rights and protections. All your original Medicare benefits are covered, often at a much lower cost, and you get additional benefits like vision, hearing, or dental care. Medicare Advantage plans usually include prescription drug coverage as well. I would like to summarize some of the benefits of Medicare Advantage for our patients. Medicare Advantage plans are usually less expensive than a supplemental Medigap plan to wrap around traditional Medicare. Patients often have lower cost sharing under Medicare Advantage plans. There are limits on out-of-pocket spending. You may receive additional services that are not covered by traditional Medicare. For instance, as I mentioned before, exercise programs or transportation or meal support. There are Medicare Advantage plans that provide both in-state and out-of-state coverage. For our patients who travel a lot or spend time living in another state, there are options for you. There aren't disadvantages to a Medicare Advantage plan as long as you know your benefits and select a plan that meets your unique needs. Many seniors struggle with the high costs of their medications, and there are options to help with this. Advise can review your medications and investigate plan options to reduce your out-of-pocket costs. Some Medicare Advantage plans offer the option of a benefit plan that does not charge a monthly premium. This is called a zero premium plan. These plans may or may not be right for you depending on the benefit design, the doctors included in the network, the medications included in the drug formularies, and the counties where the plan is offered, among other considerations. Our partners at Advise can assist you by performing a side-by-side comparison of all the options available in your county of residence and help you understand the cost of each plan, the medications covered, and whether you can stay with your preferred doctors. While we hope we have addressed many common questions, we will work with Advise to follow up on questions that we were not able to cover during today's discussion. I want to thank Dr. Jeffrey LeBenger and Dr. Jack Capitelli for their insights and perspectives about Medicare. Summit Health will continue to partner with the Medicare experts at Advise to help our patients select the best plan for their healthcare needs, navigate the complexities, and fully utilize the benefits of their Medicare health insurance. On behalf of everyone at Summit Health, I thank you for joining us today and wish you all good health.